One video, one habit, a better life after 50. Over 60. These blood test mistakes could silently cost your life. You might be making a mistake before a blood test, and it is enough to make your results look alarming even if you are perfectly healthy. According to Mayo Clinic, just one habit that seems harmless, like drinking coffee, doing light exercise, or taking vitamins, can change your numbers by up to 20%. This means you could be misdiagnosed with diabetes, heart disease, or high cholesterol and start taking medication you do not actually need. Even more concerning, Harvard Medical School warns that for people over 60, these errors not only waste money but can also bring side effects from medication, lower quality of life, and even shorten lifespan. What surprises me is that most of these traps come from morning habits everyone thinks are healthy. So what mistakes are silently throwing off your blood test results? And most importantly, how can you avoid them? If you want to protect your health and avoid costly misdiagnoses, watch this video until the end. And do not forget to like, share, and subscribe to Senior Healthy Tips 50+, where we not only share knowledge, but also send love to parents, grandparents, and to the days when we ourselves will grow old. Chapter 1. Mistakes before going to the lab. 1. Not drinking enough water before a blood test. When your body is not well hydrated before a blood test, plasma volume decreases and your blood becomes more concentrated. This can falsely elevate results like hemoglobin, hematocrit, or creatinine, making it easier for a doctor to think you have a blood disorder or kidney problem. In people over 60, the body's ability to regulate fluids is reduced, so even mild dehydration can be enough to distort results. Many people mistakenly think fasting means avoiding water, which leads to thirst, dry lips, and dark urine by the time they arrive at the lab. In reality, most blood tests allow plain water, and drinking 10 to 17 ounces before your test helps maintain stable circulation volume and makes blood draws easier. A 2018 Journal of Clinical Laboratory Analysis study found that those who drank 2 glasses of water before testing had more stable results, especially for creatinine, BUN, and electrolytes. Dehydration can make these readings falsely high, which could lead to a mistaken diagnosis of kidney disease or metabolic problems. I once had a 72-year-old patient whose creatinine came back unusually high, prompting concerns about kidney failure. But after hydrating properly and retesting 2 hours later, all results were completely normal. That one change saved him from unnecessary ultrasounds, CT scans, and costs. 2. Drinking coffee or tea while fasting before a blood test. Many believe that as long as they avoid food, black coffee, or unsweetened tea is harmless because it has almost no calories. But even without sugar or milk, both coffee and tea contain caffeine and other bioactive compounds that can affect your test results. Caffeine triggers the adrenal glands to release cortisol and adrenaline, the body's fight or flight hormones. Within 30 to 60 minutes, these can temporarily raise blood sugar by 8 to 10 milligrams per deciliter, especially in people over 60 with reduced insulin sensitivity. This can make your test suggest prediabetes or type 2 diabetes, even when it is just a temporary caffeine effect. Green tea and some herbal teas can also mildly inhibit platelet function. For tests that measure clotting ability or platelet counts, this can make results appear lower, raising suspicion of a blood disorder. Even decaf coffee or caffeine-free tea is not completely safe, as processing leaves small amounts of caffeine and polyphenols that still affect metabolism. If you add milk, cream, or sugar, the impact is even stronger. These trigger an insulin response and change fasting blood sugar, triglycerides, and cholesterol readings. A clinical chemistry study found that just 1 spoon of cream increased insulin by 28% compared to drinking only water. If your instructions say to fast for 8 to 12 hours before a blood test, that means only plain water. If you cannot skip your morning coffee, plan to have it right after your blood draw. This simple step helps ensure your results reflect your true health and avoids unnecessary diagnoses or treatments. 3. Taking supplements right before a blood test. Many people keep the habit of taking vitamins and minerals in the morning without realizing that even a single dose right before testing can significantly alter results. For example, high-dose vitamin C over 500 milligrams has strong reducing properties that can interfere with chemical reactions in lab analyzers, leading to incorrect creatinine, glucose, or cholesterol readings. Some liver enzyme and CRP inflammation tests can also appear falsely low, masking underlying problems. Iron supplements are another case. Just 1 to 2 hours after taking a pill, blood iron levels can spike 2 to 3 times above baseline, causing false readings or suspicion of conditions like hemochromatosis. This is especially important in older adults, as excess iron is linked to heart disease and liver damage. Biotin, or vitamin B7, found in many hair and nail products, is a well-known disruptor. The FDA warns that high-dose biotin can affect immunoassay results, leading to false readings for thyroid hormones, troponin used in heart attack diagnosis, and other hormone tests. There have been cases where heart attacks were missed because biotin caused a false negative troponin result. Other supplements like fish oil, zinc, magnesium, or multivitamins can also subtly affect lipid, electrolyte, or kidney tests if taken right before. The safe guideline from Mayo Clinic and Harvard Medical School is to stop all supplements at least 24 hours before your blood test, unless your doctor instructs otherwise. This ensures your results reflect your real health, so your doctor can make accurate treatment decisions and avoid unnecessary worry or wrong prescriptions. 4. Exercising right before a blood test. Some believe that light activity like walking or stretching before a blood test is harmless. In reality, even 30 minutes of brisk walking or moderate exercise can significantly alter certain lab results. When you move, your heart rate rises and muscles demand more energy. The liver releases stored glucose into the blood, which can raise fasting blood sugar by 12 to 20 milligrams per deciliter. For those being tested for diabetes or glucose control, this could cause a false reading that suggests prediabetes. Exercise also triggers a temporary inflammatory response. CRP, a biomarker used to assess chronic inflammation or heart disease risk, can rise up to 40% after even a light workout. This can make results appear as if your body is inflamed or fighting infection. More intense workouts like running, weightlifting, or cycling can raise liver enzymes AST and ALT due to minor muscle injury. Electrolytes like potassium and lactate can also rise, potentially being mistaken for electrolyte imbalance or kidney problems. Research from the Journal of Clinical Laboratory Analysis and the American Heart Association recommends avoiding strenuous activity for at least 24 hours before blood tests. If you must move, keep your heart rate close to resting and avoid muscle strain. The bottom line is that while exercise is good for long-term health, on the day of your blood test, keep your body in a rested state. This ensures results show your real condition and avoids repeat tests, misdiagnoses, and wasted costs. 5. Fasting too long before a blood test. Many think the longer you fast, the more accurate your test will be. In truth, fasting for more than 13 to 14 hours can distort several results. When fasting is prolonged, the liver ramps up gluconeogenesis to keep the brain and muscles fueled. This can artificially raise fasting blood sugar, sometimes above the prediabetes threshold, even if you are healthy. On the other hand, in older adults or those with low glycogen stores, long fasts can cause low blood sugar, leading to dizziness, shaking, or weakness while waiting for your draw. Overfasting also affects lipid levels. Without food energy, the body mobilizes stored fat, releasing free fatty acids into the blood. This can falsely raise LDL cholesterol and temporarily lower HDL. If a doctor sees these results without knowing you fasted longer than recommended, they might think your heart risk is higher than it is. The American Journal of Clinical Pathology reports that for people over 60, 8 to 12 hours of fasting is ideal for accurate results while avoiding harmful physiological changes. Going beyond 14 hours adds no benefit and can skew the data. For best preparation, have a light dinner low in fat and sugar. Then stop eating at least 8 but no more than 12 hours before your test. Drink water to maintain circulation and make blood draws easier. This way, your results will truly reflect your health. Chapter 2. Lab Mistakes. 1. Stopping your medication on your own before a blood test. Some people stop taking their blood pressure medicine, diabetes medication, heart medicine, or other chronic treatments before a blood test. They think this will let the results show their body's true condition. This is a serious mistake. It can both distort the results and put your health at risk. If you stop blood pressure medicine, your pressure can spike within 24 to 48 hours after the effect wears off. This can make your readings unusually high, which does not reflect your normal state while on treatment. Your doctor might then change your treatment plan in a way that is not right for you. With diabetes medication, stopping your pills or insulin can cause blood sugar to rise sharply after even one meal. In type 1 diabetes, this can reach dangerous levels and trigger diabetic ketoacidosis. Suddenly stopping some drugs can cause what is called a rebound effect. Stopping beta blockers for heart disease can cause a rapid heartbeat, palpitations, and a higher risk of chest pain or heart attack. Stopping blood thinners can make your blood clot more easily, affecting your clotting test results and raising your risk for a blood clot. Mayo Clinic and the American Heart Association both recommend continuing all prescribed medications unless your doctor specifically tells you to stop. Every drug has a unique action and half-life, and stopping at the wrong time means your test will not reflect your true condition while under treatment. The right approach is to always tell your doctor or lab technician about all medications and dosages you are currently taking. Your doctor will decide if a medication might affect certain tests and guide you on timing your dose, so the results stay reliable and your health stays safe. 2. Not telling your doctor about illness or medications recently taken. Many people think all they need to do is show up for the test on time. They forget to tell the doctor or technician about their current health or any medications recently used. This small oversight can distort the results and lead to an incorrect diagnosis. For example, even a mild cold or respiratory infection triggers an inflammatory response. This raises white blood cell counts and CRP temporarily. If you do not tell your doctor, they might think you have chronic inflammation or an immune disorder. Similarly, common medicines like ibuprofen, acetaminophen, or other NSAID can raise liver enzymes slightly. If your doctor does not know you took them, they might suspect liver disease and order more tests. Some antibiotics, allergy medicines, or even high-dose vitamins can affect blood counts, cholesterol, or kidney function. Mayo Clinic and Johns Hopkins Medicine note that even seemingly unrelated factors like a recent vaccination, strenuous exercise, or herbal supplements such as ginseng or turmeric can alter results. The key rule is to give full information about your current health, even temporary conditions, and list all drugs, supplements, or herbs taken within 7 days before the test. This lets your doctor read the results in the right context, avoid confusion, and make the most accurate diagnosis. 3. Not paying attention to the time of day for your blood draw. Many people assume that blood test results will be the same no matter what time of day. In reality, many biochemical and hormone levels vary significantly with the time of day, a pattern known as the circadian rhythm. Ignoring this factor can skew results and make it harder for your doctor to give an accurate assessment. For example, cortisol peaks between 7 and 9 in the morning, then declines and reaches its lowest in the evening. If you test cortisol in the afternoon, it will appear much lower, which could lead to a false suspicion of adrenal insufficiency. Testosterone in men is also highest in the early morning and decreases as the day goes on. A man with normal morning testosterone could be misdiagnosed as deficient if tested at 4 or 5 in the afternoon. TSH, the thyroid-stimulating hormone, also fluctuates. Testing in the morning before breakfast gives more accurate readings compared to after eating or late in the day. Harvard Medical School recommends scheduling hormone and metabolism-related tests in the morning, usually between 7 and 9, when your body is most stable after sleep, and before the day's activities, meals, or stress affect your levels. If you want your results to truly reflect your health, especially for hormone, lipid, or fasting blood sugar tests, try to schedule each checkup at the same morning time. This keeps your results consistent and avoids false diagnoses. Chapter 3. Mistakes in reading and comparing results. 1. Not disclosing over-the-counter medications or herbal supplements. Many people think they only need to list their prescription medications when getting a blood test or health check. In reality, over-the-counter medicines and herbal supplements can also affect test results, sometimes enough to mislead the diagnosis. For example, ginkgo biloba, a popular brain health supplement, inhibits platelet aggregation and thins the blood. If you do not mention it, your doctor may not understand why your clotting time is prolonged or your platelet count appears abnormal. Turmeric and garlic, often used for inflammation or heart support, have similar effects, increasing bleeding risk when combined with blood thinners. This is especially dangerous before surgery or invasive procedures. Some herbal teas, like strong green tea, licorice tea, or nettle tea, can affect liver enzymes, kidney function, and even blood pressure. For example, licorice can raise blood pressure and lower potassium levels, leading to misleading electrolyte results. Mayo Clinic notes that many herbs contain potent bioactive compounds that can impact the liver, kidneys, or cardiovascular system, altering test values like AST, ALT, blood lipids, or blood sugar. If your doctor is unaware, they may misdiagnose or order unnecessary tests. The safest approach is to always bring a list of all medications, supplements, and herbs you take, including dosage, frequency, and timing, when visiting your doctor or getting a blood test. This ensures the results reflect your true health and prevents dangerous interactions between medications, herbs, and medical procedures. 2. Assuming all labs give the same results. A common mistake is believing that blood test results from any laboratory are identical and directly comparable. In reality, each lab may use different equipment, reagents, analysis methods, and even reference ranges. This means a normal result at one lab could be flagged as high or low at another, even if your health has not changed. For example, a fasting blood glucose test might read 98 milligrams per deciliter at one lab but 104 at another, simply due to differences in machines or sample handling. While this difference is minor for your health, if your doctor does not know you use two different labs, they might suspect you are approaching prediabetes. Similarly, cholesterol, liver enzymes like AST and ALT, creatinine, or thyroid hormones such as TSH can vary slightly between labs. According to the College of American Pathologists, allowable differences can reach 10 to 15% depending on the test. For sensitive markers like TSH or CRP, this variation can lead to unnecessary medication changes. The safest practice is to use the same lab for regular tests if you want to track changes over time. If you must switch labs, bring your past results so your doctor can compare them and account for technical variation before making decisions. You can also ask the lab for the reference range they use to avoid misinterpretation. Understanding that not all labs are the same can save you from unnecessary worry and help ensure that medical decisions are based on consistent, reliable data. When you pass the age of 60, every blood test is more than just a health check. It becomes a map that guides the remaining years of your life. One wrong number, one misinterpreted result, could lead you down an unnecessary treatment path and take away the days that could have been healthier and lighter. I have seen patients who simply changed a few habits before their tests, drinking enough water, avoiding coffee, reporting all medications they were taking, and their results improved dramatically. The red flags from the previous visit were gone. That is not magic. It is the power of knowing what to do. And if you are wondering, have I ever made one of these mistakes, start reviewing your habits today. Because every accurate test is another chance to protect your heart, your memory, and your independence. If you find this video helpful, please like, share, and subscribe to Senior Healthy Tips 50+. Here, we not only share easy-to-understand medical knowledge, but also send love to parents, grandparents, and the future days when we will grow old ourselves.